Hi everyone, this is Himaja, Senior Nutritionist from Wilson's Health Community. So, just in 30 seconds, a brief transformation of mind. So, with the help of Wilson's Community, who is working on a vision to eradicate diabetes, I have successfully reduced 20 kgs of my overweight, so from 88 kg to 68 kg, and have successfully reversed my HbA1c levels from 8.7 to 5.3 in just 4 months of time, and I have reversed my PCOS issues and disc bulge, arthritis, osteoporosis. Okay, so now I am a successful and wonderful and 360 degrees woman right now in front of you to share you some exciting stuff. So how Wilson's community has helped me to reduce my overweight and to reverse all my health issues. So here right now on the screen, all of you can see weight loss, guys, because this has now become a global epidemic nowadays, because even if you see the numbers are also, they are shocking worldwide. India almost needs to lose weight. So 73% of urban Indians have to lose weight, and almost half of the urban Indians are in overweight condition, and maximum risk age is 28 to 38 years. So why we are specifically mentioning this risk age? Because at this time, almost they would have been settled in their married life, in their professional life. Okay, and some of them have got would have got kids as well. Okay, so buying or purchasing properties out of money or through loans. So many things, almost some sort of settlement, and that mind of settlement would have come to people. Okay, and hence they start neglecting their health, and hence 28 to 38 years is the maximum risk age. And average BMI in India is 25.5, and almost every Indian needs to lose 11 kgs of their overweight. So almost 1/3 of the world population is also in overweight. Okay, and even if you see the numbers also, obesity has almost tripled since 1975. So in 1970, almost 45% of US population was in overweight. And when coming to 2020, almost 74% of the US population is in overweight. So what are the risks of being overweight? So being a nutritionist nowadays, so many people approach me and tell like, ma'am, even though I am obese, I am very much active and energetic. Then why should I reduce weight? There is no need, because I am able to carry out all my works. But guys, the risk of overweight will be much more in the next upcoming years, maybe 2 years, 3 years, or 4 years. Okay, so either people can go into type 2 diabetes or get affected by high blood pressure levels, heart diseases and heart stroke, and high cholesterol levels and gallbladder disease. Okay, so even the secretion of bile juice also will not be of good quality, and people may get affected by sleep apnea, that means snoring in the sleep. So for people who are going to snore, it will be very much happy to them. Okay, but for us, definitely it will be very much uncomfortable, and people may go into fatty liver disease. So there is again alcoholic and non-alcoholic fatty liver. For people who are in obese condition, definitely they will be going into this non-alcoholic fatty liver disease. And next again, they may get affected by cancer. Okay, and next osteoarthritis, because even our knees would have been designed to bear only our ideal weight. But when we are going and becoming more and more obese, so definitely we also will get affected by our knee pains and joint pains, and definitely we will be moving into this osteoarthritis condition. Okay, so I now understand the risk of being overweight. So what should be our ideal weight map? So this is what most of the people ask me. So here on the screen, we are showing here BMI. So starting from 18.5 to 35 with various conditions like underweight, normal, overweight, obese, and extremely obese condition. So the ideal BMI is 22. So when we consider the BMI in green color in normal, okay, so from 18.5 to 24.9. Okay, so the average is 22. So for ideal BMI 22 basis our height. So a general calculation like how much weight can we be in. For example, if someone is at 5.4, they can be at 58 kg. If someone is at 5.8, they can be at 66 kg. And if someone is at 6 feet, they can be at 74 kg. Okay. And next, so now in order to understand how we have to reduce weight, so here we have understood for our height how much weight we have to be in. And one more major thing that we need to understand is the functions of insulin, because this is the main reason for us to become obese. So if you are able to concentrate next 2 to 3 minutes to understand the science behind, definitely will understand what is the reason for you becoming obese, guys. Okay. So here on the screen, they have shown a body cell. Okay, and insulin is represented as a key, and there is an insulin receptor. Okay, so generally what happens is whenever we take food, glucose will release into the body and insulin also will be secreted. So now what this insulin will do is whatever energy is getting released into our body, it will push into the body cells through insulin receptor. So now what happens, just like a air balloon or water balloon, our body cell also will have a certain capacity up to which it can accept the glucose. So if that limit is exceeding, then what happens is even our body cell also cannot accept it. Okay, so then what insulin will do? It will convert all these additional energy levels, okay, into fat, and it will store at different parts in our body. Okay, so energy levels in the sense means glucose that is getting released from the food. Okay, so in this way, insulin has two functions. The first thing is pushing glucose into the body cells. The secondary function is the additional glucose getting converted into fat, and it will store in different parts in our body. So this is where insulin is acting as a fat storing hormone. So in this process, what happens is our body cells also will come to an understanding like there is no work for insulin, just it will be pushing glucose into us. So let us not listen to insulin. So this is where our body cells will stop responding to insulin, and that's where our body will get affected by insulin resistance. Okay, so when a person is becoming insulin resistant, generally people will think like I got affected by diabetes and my insulin is not working, but that is not the case, guys. Okay, so it is only just one of the metabolic syndrome, type 2 diabetes. Okay, so other metabolic syndromes can be is like we may get affected by heart diseases or high lipid problems and hypertension. Okay, as we discussed, type 2 diabetes, becoming overweight, okay, and getting into dementia, loss of memory, and even cancer and polycystic ovarian syndrome. So most of the women, so almost 7 women out of every 10 women are suffering from these PCOD issues nowadays. And the sad part is like they are depending on so many hormonal pills and medications. But the thing is, with the help of Wilson's diet, they can definitely reverse this PCOD and infertility issues in 120 days. And one more thing is, long-term PCOD will result in infertility. So whenever we analyze some of the symptoms of it, okay, so definitely we can understand whether we got affected by this PCOS issue or not. And we can take that steps immediately to come out of that situation. Okay, so in our another video recording PCOD, I will be explaining about it as well. Okay, and next is non-alcoholic fatty liver diseases also possible. Okay, and now what should be the right foods that we can take? So here in the scale that they have shown, so from 0 to 6, okay, in green and yellow color, fat, protein, and vegetables. So they require few to less amount of insulin to digest them, and they are hence good to take. And 6 to 10, tubers and refined carbs, definitely it is good to avoid them since they require lots of insulin to digest them, and insulin spikes will be more in the body. Okay. And now understanding this, we need to understand the basic science behind why we get into overweight. Okay, already we have understood. Now we need to understand how can we reduce this overweight. So for example, here as in the slide, okay, after we take food, as I said, glucose will release into the body. So insulin will be secreted and additional glucose levels are getting converted into fat and we are becoming obese. So all these days we have followed the upper process. So now here what we are going to do is in our Wilson's diet, we'll be following the down process which is explained. That is nothing but fasting. So fasting literally doesn't mean fasting. It is intermittent fasting where you can eat to the stomach full without any cravings. Okay, and easily and happily you can reduce your overweight. So how this is going to happen? So when we are into intermittent fasting, our blood sugar levels will come down. So pancreatic alpha cells, they will release the glucagon, that is stored fat in our liver. Okay, after glucagon, the fat from remaining parts in our body also will get accessed. And all this fat will get converted into glucose again. So liver will be doing this function. It will break glycogen into glucose and then it is being pushed into our body cells to release the energy for us to perform these daily activities. Okay, so this is the basic process of glycogenolysis and the basic science which will help us to access our body's fat ideally. Because when we are not following this glycogenolysis process, what happens is we will be losing only our muscle mass, which is not going to be a sustainable one. Okay, so in order for us to have a sustainable weight loss, we need to follow this process and focus on ideal fat loss so that we can maintain our BMI even after the diet is over. So now understanding about the food items, about the basic science behind. So most of the people ask me, tell us the diet we will do. Okay, if there are 2 to 3 persons in a home, So definitely the shirt which fits for one person, definitely it is not going to fit for another person. So here the first and the basic thing is we believe in the four pillars of optimal health, mental health and physical health. So definitely you would have been having that mindset like you have followed various things till now in your lifetime, but you were not able to get that results. So this time you have to believe that. So Miss Himaja, senior nutritionist from Well Science Health Community is there with you and she is going to help you in this journey. And definitely you will be you will be reaching and achieving all your health goals with that positive mental attitude and mindset. And also next thing is adequate rest of 6 to 8 hours a day so that your cortisol stress hormone levels are not going to increase in your body. And next is exercise to keep us fit. Okay. And also it is going to reduce our cortisol stress hormone levels. And in the final and the last part comes food and nutrition. So where Himaja is going to help you in the diet part. Okay. But in order for me to help all you guys, definitely I can't do it individually. Okay, I need all these health assessment reports in order to understand and analyze your body condition. Okay, suppose that after getting a complete analysis of you, I'll be able to suggest you the personalized diet. And so the first thing is knowing your BMI, okay, age, height, and weight details, so that we can calculate your BMI. And next, and we can understand how much weight you have to reduce. And next is lipid profile. So what is your LDL value, HDL value, total cholesterol value? Okay, so all these things we need to understand. Next is HbA1c levels. Okay, so HbA1c is nothing but blood glucose average of last 3 months. So we need to understand our HbA1c levels as well, so that if we are into pre-diabetic or diabetic condition, even in this diet, we can reverse that also. Because out of every 10 people who approaches, almost or at least 5 of them are into this pre-diabetic or diabetic condition, which even they don't know until unless we ask them to bring some blood test reports. And next is thyroid. So we may be having high TSH values and abnormal thyroid profile, which may also be reason for us to put on the weight. And next is having hemoglobin deficiency. So in this diet, the utmost thing is we need to have optimal hemoglobin levels since we are be working on the concept of insulin resistance. Okay, so we need to ensure optimal hemoglobin values. If not, then we will be helping you in that part. And next is creatine. So we need to understand about your kidney functioning as well, so that we will be able to guide you on the optimal carbohydrates, what we have to take, optimal protein that we need to have, and how much water we can intake. So we'll be able to understand all these things. And the next and the final thing is vitamin D. So we will call it as immunomodulator. Having lesser levels of vitamin D in the body may also lead us to become an obese person. Okay. And also our immunity levels may come down. So, and next, one more thing also you can add is vitamin B. So when vitamin B levels are less in our body, our immunity may come down and our metabolism also may come down. Okay. So here we need to understand about vitamin B levels as well. Okay. So once when you are ready with all these things, okay, so definitely I will be able to suggest you the diet plan. So for further more queries, consultations and inquiries, you can approach me guys. So this is Himaja, senior nutritionist from Well Science Health Community. And my Facebook and Insta ID are Healthy with Himaja, and even LinkedIn and YouTube ID are also the same. And my contact number is 8056068209. Okay, so please feel free to WhatsApp me. So definitely I will be there to help you to reverse all your lifestyle disorders and health issues. Okay, so stay fit and stay healthy.